Hey everybody, my name is Dr. Kevin Mao, and with me today is my wife Twee, and together we own and operate Balance and Better Restoration Physical Therapy Massage, which is a physical therapy massage clinic located in the East Bay of California in a town called Dublin. And in today's video, I want to share with you how to stretch and how to release hip flexor tightness. Now, hip flexor tightness is a very common problem that we see here in the clinic since we work with a lot of people who are spending a lot of time sitting at their desk, sitting over a computer, or just driving back and forth in a ton of traffic here in the East Bay. And this can cause a lot of very common problems such as chronic lower back pain and stiffness, just general hip pain and tightness, or even sciatic nerve pain, which is a very painful condition which causes pain that shoots all the way down the back of the leg. And I want to share with you a very common routine and a set of exercises that is very popular amongst a lot of our patients, and I hope that this is able to help you as well. And in this video, we're going to go over our three-step method for actually releasing hip tightness in a way that's very comprehensive and just tries to check all the boxes in terms of setting up for a very thorough, comprehensive therapy process. So the three steps that we want to go over today involve first learning how to roll and release the tightness in the muscle, two, then how to actually stretch appropriately the muscles in the front of your hip flexor, and then three, to teach you how to strengthen everything around it to make sure that we are providing enough support structure, take some pressure off of muscles that are constantly overstressed or overworked. So let's get into our very first video, which we show you how to roll and release the tightness within the muscle of your quad and of your hip flexor. So let's get right into it. Okay, so in this first video, we're going to show you how to properly first roll and release muscle tightness within your hip flexor or within your quad muscle, because this is a very, very common problem that we see here in the clinic. Now, the reason why we want to start with teaching how to roll out or teach you how to release the tightness within the muscle is because I want you to think of a muscle like this long elastic band here. Now, if this was a muscle, such as my quadricep muscle that runs from the top of my hip all the way down to the middle of my knee, if I were to tie a bunch of knots within the middle of the muscle, because this is how muscles typically function when they get very, very tight, is they start to get really, they start to form these contractures, or they start to form these things called trigger points. And if I tied a bunch of knots within the middle of this muscle, what you're going to see here is the muscle is going to start to shorten. It's going to start to tighten. Now, a lot of people think that all you need to do is start to stretch. And while this can help for some people, a lot of times when people try to stretch muscles that just have a bunch of these kinks in the middle of it, they don't actually get a longer muscle because you're just making these knots tighter and they're still there after you perform the stretch. So we actually want to use this roller here as a means of helping you identify where these trigger spots or where these little tight spots actually are, and then to teach you how to release them, which will set you up for a much more effective series of stretching and a much more effective way to actually strengthen the muscles around your hip. So let's help you demonstrate how to thoroughly and properly release your hip flexor and quad muscles. So Twee here, she's going to start on her right side, and we're going to have her start on the top of the hip. And we're going to have her start on the muscle on just kind of the side of her thigh here. There's a muscle on the outside, or there's a group of tissues on the outside part of her leg known as the IT band, and there's also the center of the quad muscle right in the front. And we just want to generally start kind of in the middle of the two. You can do the front if you want. You can do the IT band if you want as well. But we typically find that a lot of people just kind of struggle with that area kind of right between the two. So that's where we're just kind of show you how to start with today. So Twee here is going to start on the top of her hip. And what she's going to do is just start with a very slow scan of her muscle. She's not going to roll aggressively. She's not going to just be digging in right off the bat. We're just going to have her roll very, very, very slowly down the muscle. And what we are looking to identify are parts of the muscle which just feel way tighter and way more tender than the rest. So Twee, let me know when you find one of those spots. Again, it should feel just tighter, more tender. Okay. Okay, great. So this is very common once you start to practice this technique of the scan, is you will undoubtedly feel areas that are just way tighter, way more tender than the rest. And what you're effectively on is one of these things called a trigger point, or one of these knots here. So once you've found one of those spots, you don't want to just roll off those spots. You want to make sure that you learn how to appropriately identify and then release that spot. So once you're there, Twee, just take a couple of nice deep breaths. And what's going to happen is we want to use our breathing to help relax and reset some of the contractures that the nervous system has put in place within that muscle, okay? And what you can do here, if the spot is very tight or very tender, is you can use your left leg, or you can use your arms just to take some of the pressure off of the leg if it's just too much pressure. And then as you continue to breathe, you'll start to feel some of the tension start to release. You'll feel the pain start to dissipate. And then over time, you'll be able to sink more pressure into the muscle. And that's how you know you have thoroughly released the muscle. So let's do a couple more breaths. And generally in the beginning, when you're just trying this out, I try to advise to try to perform at least 5 deep breath cycles just so you can start to get into the habit of learning how to identify and start to learn how to release some of these muscles. Okay, let's do one more breath. Okay, let's go ahead and scan down the leg a little bit more. So we're going to look for another trigger spot. So let me know when you've found a spot.
Right here.
Okay.
Right beneath it.
Okay, so that's where it is. So she's going to do the same thing. She's going to take a couple of deep breath cycles. Breathing is key for this exercise because again, breathe is going to help just bring some level of relaxation to your nervous system just to help you train yourself to unwind and start to unlock some of those areas of muscle tightness that you just may not be aware of. Okay. Some of the most common mistakes that we see people make when they do this foam roller is they're just rolling up and down, they're just rolling aggressively, and what they're doing is just inflicting a lot of just pain and trauma onto their muscle, and it's not really doing much. But when you do it with this approach where it's a little bit slower, a little bit more controlled, a little bit more methodical, we find this technique to be just way more effective for a lot of our patients. Let's just do 2 more breaths. Good. Okay, and let's try to roll for, find one more spot a little bit closer down towards your knee. Just stop and let me know when you found a spot. Yeah, so Twee's pretty experienced at this, so she's just kind of like searching around. She's working on the side, she's working on the front, she's working all the way onto the IT band. Okay, great. So again, once you start to do these scans, these trigger points or these trigger spots are very, very, very easy to find. It's unmistakable when you find these spots. So just learn to identify them, breathe, have a little bit of patience, and over time you'll start to really feel the effectiveness of this technique.
As I'm breathing, I can feel my muscles sinking into the foam roller, and the pain is also like dissipating.
Okay, great, awesome. So that's exactly what we want to, that's how we know we're doing some effective work is you'll be able to, as Twee said, when you do this for a long enough time, you will actually start to feel some of the pain dissipating. You'll feel sometimes the muscle actually softening under the roller. Just takes a little bit of time, takes a little bit of patience and some practice. But again, very, very effective technique for anybody that's experiencing hip pain or hip flexor tightness. Let's just do 2 more breaths. Okay, great. Yeah, so just doing one scan, just again, just up the muscle just to make sure she's kind of found all the spots. Some people might only have 1 or 2 trigger spots. Some people might have like 8 or 9. The goal is just to just work on them and just chip away at them over time, and just to learn how to perform the technique is the most important thing. All right, might take a couple of weeks for you to learn how to master this, but it's one that's very worth your while. So okay, so great job. And we would definitely recommend trying to do it on both sides. Even if you have a lot more pain or a lot more tightness on one side, it's also good for you just to test the other side, just to see what it feels like, and to also make sure that you're not developing too many imbalances as well. So that's it for the roller part of how to release hip flexor tightness. So let's get right into a couple of the stretches that you can try. All right, so now we're going to go over how to properly stretch and open up the hip flexor muscle once it's been rolled out. So Tweet, go ahead and get onto your right knee with your left leg forward. So we're just going to use this blue foam pad here just to provide some cushion for her right knee. You can use a couch cushion, or you can use a couple of pillows, or just anything just to give your knee a little bit of cushion and support. Now, we're just going to spend a minute or so just going over the positioning of this stretch, because the positioning is the most important part of the stretch, because it will ensure that you have a very successful stretch and that you're not just kind of leaning into certain imbalances that are very common for people with a lot of hip flexor tightness. So the most common problem that we see when people do the stretch is, go ahead and lean back a little bit, is we'll start to see a lot of this where people don't have generally good awareness or of the alignment between their knee and their hip and their back. So again, for instance, we see a lot of people who are struggling with a lot of back pain, back tightness, or back stiffness just because of how tight their hip flexors muscles are, and their hip flexors just create so much tightness that actually pulls them forward. So what we want to do when we're in this stretch is to make sure that we are not allowing any of this kind of forward bending or forward tipping of the pelvis, known as an anterior pelvic tilt. And we actually want to start to level all that out through here. So we want to, as you can see now, her back is way straighter, and most importantly, her pelvis is kind of level, which means that it's more parallel with the floor and with the ceiling than it is like tipped forward, like how it was before. So that's the first thing. So to make sure that you're kind of just kind of zipping up your pelvis and trying to keep things as level as possible. And the next thing that will really start to help you become aware and really help you stretch and open up the hip flexor is just to squeeze this right glute muscle here. Okay, what do you feel when you do that, Tui? Where? Okay, great. So once she engages this glute muscle, what it's going to do is it's going to start to really call into action how tight that muscle in the front of the hip flexor and the front of the quad is. And once you reach that point where you start to feel some tightness, I want you to take a nice deep breath in. And as you exhale, just push a little further into the stretch, making sure that your hip stays level and your back stays straight through here. Okay? And we'll just practice that a couple more times. Breathe in, breathe out, and push a little bit more forward. Make sure your back is straight, keep your abs tight. And one more time, squeeze that glutes, exhale, and just push a little bit further forward. You don't need to go very far with this stretch. If you keep that glute tight, if you keep your back straight, you'll feel enough of a stretch as it is. And if you're going too far, you're probably not keeping your back as straight as you probably need to. And let's do that one more time. Breathe in, breathe out, and push into the stretch. Okay, so great. So that's our favorite hip flexor stretch. Let's just show you one more variation of how to stretch your hip flexor in the event you just don't have a pad accessible to you. So let's get right into it. All right, so the next stretch I want to show you is just a modification off of the first hip flexor stretch in the event that you have a little bit of a difficult time getting down to one knee, or if you're just looking for something that you can do after a drive, or if you're just kind of sitting in your chair. This is one that will also help open up some of the tightness of the hip flexor, while just being a little bit easier so you don't have to get down to one knee. So Tree here is just going to sit next to this chair, and we're just going to use a chair just to give her arm a little bit of support, just to help with balance and whatnot. And she's going to start with by kicking her right leg back, and her left leg will be forward. And just going to kick the right leg back just a little bit further. Perfect. And same thing with the first initial hip flexor stretch. You want to make sure that your back is straight. You want to make sure that your hips and pelvis are level, and then just try to like tuck your pelvis under, and also make sure your hips are square as well. She's rotating out to the right a little bit, so we're just going to square her up a little bit there. And go and squeeze that glute and tell me what you feel.
The tightness around this area.
Okay, perfect. So again, same thing. Once you really tighten up that glute and really get the pelvis into the right position, that's when the stretch will just start to emerge. Okay, and then from there, just take a nice deep breath in. Exhale and just drop your knee just a little further into the stretch. You don't need to go don't need to go too far with the stretch, just enough for you to feel that pull and just start to feel some opening in that muscle in the front of your hip and the front of your thigh. So just going to practice just a couple more breaths. Breathe in, breathe out. It's 2. Again. It's 3. Go ahead and bend that knee just a little bit more. Perfect. Tighten up that hip. Pull up your pelvis. Good. 3. Down. And last one. All right, perfect. So that's, you can take a break, Cree. Nice job. So that's the second modification for the hip flexor stretch. Again, very effective at just helping you release the excessive tightness in the front of the hip. So we're going to get into the next exercise, which is one of our favorite hip strengtheners, just to give you some more support for your hip to make sure that it doesn't get overworked. Okay, so this is the first of 2 hip strengthening exercises that I want to show you. And this one, Twee will be starting on her hands and her knees. And this is a great exercise just to help you isolate and just kind of help you really focus on feeling the contraction of your glute muscle through here. And the stronger this glute muscle is, the more that will just kind of help counteract the tightness that might develop in the front hip flexor muscle. So what T here is just going to do, she's going to just slide back her heel, and then she's going to lift her leg as high as you can towards the ceiling, but making sure that her back is not arching. So you want to make sure you keep your back as straight as possible. And if you start to feel your back arching, exactly, good job there. What she did, she just kind of tightened up her core just to make sure that she's not overextending her back. And also make sure that your pelvis is staying level. People sometimes have a tendency to overly rotate their hips like this when they're facing a lot of hip flexor tightness through here. Just try to keep your pelvis level and just focus on just really tightening and squeezing this right glute muscle through there. Go ahead and pull that leg back in. All right, and we'll just show it one time on the other side. So go ahead and lift your left leg here. For all these exercises, we also recommend that you all at least try a couple of repetitions on the non-affected side as well. It's just generally a good habit to get into. So hold it for 5, 4, 3, 2, 1. Good. And she's doing a really good job of keeping her back straight through there. Let's show it one more time on the right side. So I'm going to slide that leg back and kick it up. And I recommend doing at least, just following the rules of 5s. So do it 5 times, hold the pose for 5 seconds. 4, 3, 2, 1, pull it back in. And let's do the left leg one more again. And about 3 sets on each side is completely fine, just to help you really feel the full effect and just get the most out of the exercise. So 3, 2, 1, pull the leg back down. All right, great job. So again, this is our first exercise to help you just kind of strengthen the hip area. And again, our goal is to help you take pressure and tension off of the tight hip flexor muscles because they're generally overworked. But by activating, strengthening all of the muscles around the hip, we're able to help take some of the pressure and tension off of that overworked tight muscle. So let's get into the very last exercise, which is the glute bridge. Okay, so this is the last exercise for today. This is an exercise called the glute bridge. This is one of my favorite overall hip strengthening exercises, and it helps do wonders at helping release tightness in the front of the hip flexor because it really helps strengthen the muscles in the glute while also simultaneously helps open up and stretches the hip flexor muscles as well. So so go ahead and demonstrate just one time, Twee. Just go and lift your hips up in the air. So Twee's doing a good job of doing it properly, where she's keeping her core tight, her back is staying straight, and she's doing a good job of really kind of tensing and creating a lot of engagement and contraction in those glute muscles. Going to come back down. But the most common mistake that I would say that people make, going to do it with an arched back, is when they do this exercise, they'll just kind of overarch their back and they're not really paying much attention to what's happening at their glute, what's happening to their pelvis. It's going to come back down. So one way to correct that is before you get into the lift, just make sure that your back is completely flat and flush against the floor so that I wouldn't be able to sneak my finger through. That will make sure your back is staying really straight the entire time and to make sure your core muscles are engaged. Once you do that, that's similar to just kind of keeping everything flat and keeping everything level when we were doing the hip flexor stretches, and that will make sure that you're not getting any bad habits or any overcompensation in the wrong muscles. So again, just go into a couple of bridges now. So the next thing I want you to focus on is at the top of the bridge. Just try to squeeze and contract your glute muscles as tight as you can, and hold that for 5, 4, 3, 2, 1. Good job. Come back down. And what you might feel sometimes is you might start to feel some shaking, you might feel some quivering, and that means you're doing the exercise correctly because you're really working hard to contract and fire all of the important stabilizer muscles while also just kind of undoing some of the tightness in the front of your hip. Let's practice that a couple more times just to show. So good job. Flat back, tight core. Let's lift those hips and glutes up in the air, and let's hold that for 5, 4, 3, 2, 1. Good job. And come back down. And for a lot of our patients that have a lot of hip flexor tightness, you actually might feel some type of stretching, some type of opening as you do this exercise. So let's just try it one more time. Nice job. Flat back, hips up, squeeze and tighten and hold. 5, 4, 3, 2, 1. Great. Okay, Tweet. Thanks again for showing everybody. And that's it for our hip opener series. So again, we just started with our routine of roll, stretch, and strengthen. And so we started with showing you how to foam roll, followed by a couple of variations of how to stretch. And these are just some of our favorite strengthening exercises, not necessarily to strengthen the muscles of the hip, but instead to strengthen the muscles around the hip flexor, just to take some of the pressure and some of the strain off of a muscle that could be overworked and too tight. So that's it for today's video. Hope you enjoyed, and we hope to see you again next time. So take care, have a wonderful day, and we hope to see you again soon.